Broadcasting from the Nurse TV, the southern tip of Africa. And today we're introducing Sister Cindy Hatchett, who is a community nursing sister. But she has written a book on her encounters in both informal settlements and around Africa and in Borneo. Sister Cindy, thank you very much for joining us on this occasion.
Thank you for having me on the show.
What triggered off you writing this book?
I think it was finding a woman out in the rural areas in deplorable conditions in a shack, and also the importance of writing down memories so that they are not forgotten, and also so that other nurses can learn from those situations and be advocate for the patients.
So you've worked within the community and community nursing, not only for very informal settlements or informal settlements, but also super rich people. Is there any differentiation when it comes to disease?
There is no, illness does not discriminate at all.
No.
And everybody is the same when they are needing help.
So you go physically into their homes, assess the situation with the family, make sure that the patient is looked after in the best way that they can at home, and you organize the medications to go into the home for the patient. Is that correct?
We do what we can when we are called out to the homes, and if the patient needs further treatment, then they are referred on to doctors or to nearby clinics.
You've worked in quite a few situations, though. You've run a clinic for a security company, which was a very big security company in Gauteng. So you had, how many patients in a day would you see?
It was on average about 30 patients in a morning we saw.
Cindy has qualified in such a way that even though she was under the auspices of a doctor, she was working in a rural clinic and she was diagnosing and medicating these patients. And they didn't want you to go, but you did leave and you came down then to the Western Cape. Mm. And since then you've been working in the townships, doing hospice in the townships, is that correct?
Not only hospice care, it was doing a primary health care and community health care. So going out and providing whatever the patients required, be it emotional help, dressings done, whatever the families and the patients required, we tried to offer the assistance that we could.
You had a little bit of help in the communities because you had carers who walked around the communities and referred people back to you, is that correct?
That is, and the carers are the real heroes. They live in the communities that they serve, they are known by the communities, and they actually make sure that everybody who calls on them, they call the professional nurses, and then we go out to their homes. So the carers also do the translation when there's a difficulty with languages, because South Africa is such a multicultural, diverse country.
Yes.
You do need translators, and they are wonderful people, the carers.
So watch out for Sister Cindy's book. As I say, this is the first one. It's available on Amazon, and her second what would you call it, compendium volume of 12 patients is due to come out soon. Thank you so much. You're an inspiration to any community nurse. Thank you for joining with us today.
Thank you for having me on the show. Thank you.